Welcome back to Ask Allison. Here is today's question. What are the options for health insurance for private practitioners? I left my group practice and started my own practice about 10 months ago, and I'm still covered under the COBRA plan. I know there are differences from state to state. I'm in Illinois. But other than looking at marketplace plans, are there any other resources available when seeking out affordable PPO plans or ways to get discounted premiums? I'd appreciate any guidance. Thank you, Allison. So first, I'd like to thank Therapy Notes for sponsoring Ask Allison. Therapy Notes is a comprehensive practice management system. It keeps everything in one place: your notes, calendar, insurance and billing, your practice paperwork, your video conferencing. You can have a totally paperless office all under one system. It costs less per month than one session fee and prevents that documentation anxiety so many of us get. I'd love that you can call and you can talk to an actual human if you have a question. And it's not just me, it's the highest rated EHR on Trustpilot. So if you've been dragging your feet or unhappy with your current EHR, check out Therapy Notes. You can get 2 months for free if you use the promo code ABUNDANT at checkout at therapynotes.com. All right, so there are a few options to look into, and I'm going to invite anyone and everyone who is hearing this to pop anything in the comments that you know of that I don't cover, because I'd like us to share some information here. How much it costs does totally depend on your state and the plan, but there are some ways to get in on some deals. So I would check with a health insurance broker. Health insurance brokers don't cost us anything to use. I guess the insurance companies pay them. I don't know how that works, but I know we don't have to pay them. They have this inside line on plans that you can't find on the marketplace. It's what my family did since my partner and I are both self-employed. Think about it kind of like travel agents can get better deals on everything than we can find. It's similar to that. Know that if you run it through your business, which I recommend, your health insurance is a tax write-off. I've also heard that some Chamber of Commerce members have access to group health plans, depending on the city. So you'll want to do the math to see if it's a good option, whatever's available for you there. And I'd also talk to your accountant to find out if you qualify for tax rebates based on your income. And basically, like, the long and short of it is that in private practice, once you're full, you should be making so much more money that paying out of pocket for insurance shouldn't hurt you. I mean, none of us want to pay more money than we have to, but if it takes 2 or 3 sessions out of every month to cover your health insurance, it's totally worth it. Today's free download is a list of considerations when you're choosing a health plan. I really agonized over choosing the right health plan when I got insurance for my business. But the truth is, honestly, there were not that many great options. Even if I was willing to pay a ton, which I wasn't, there weren't great plans to choose from. I spreadsheeted stuff. I made my pros and cons list, and eventually I chose a good enough plan. I still haven't met my deductible, and we're near the end of the year. So whatever, we do what we can to make sure that we are safe and healthy and that our family is safe and healthy. But know that when you're looking at plans, it's going to be unlikely that you're going to find something that really meets all of your dreams for a health insurance plan. And that's whether you're working for a big agency or whether you're in private practice. Health insurance just kind of sucks. So that's what I got for you guys today. If you have any questions for Ask Allison, please DM me over on Instagram. And yeah, make sure that when you are setting your fees, you're including how much you're having to pay for health insurance. All right, take care.